based on our conversation we had before when we were prepping this,
Hmm.
I shared with you, that, okay, knowing that she's got this spondyloarthritis that's in her background,
Hmm.
and knowing that we've got, potentially a person in the little bit older than what we typically expect for one of these inflammatory arthropathies to
Hmm.
present with, yet she does have the symptoms that are intermittent. So I would not have thought probably I don't know if as quickly to go to that as you, but having my own personal experience with this where I did have iritis and I did go through a rheumatological exam and they did find positive HLA-B27.
Yes.
Um, so yeah, and like we had talked before, that yeah, that's a pretty crummy thing to learn, but in a way, it's valuable being a clinician when you start to experience some of these things.
Well, it's really interesting because you bring up some really good points. First of all, it used to think that women never got ankylosing spondylitis because that's
Yeah.
where my head went here. Turns out that women actually do get ankylosing spondylitis. It's just slower to develop. Don't see it till like early middle age because normally we're thinking like teenage boys where we really start to see the symptoms. But we wait long enough and these symptoms can kind of rear their ugly head. And because for years they thought women didn't get this, they were never diagnosed. But it is slower to develop. And I think the literature now says about 22% of people with ankylosing spondylitis are female. So there's like a 3-to-1 ratio, depending on what literature you read, but it's around 25%. There's also some good evidence that the earlier it's detected, the better the outcome. So, it's kind of in the healthcare field's best interest to make a proper diagnosis. Again, it's not going to change the way we treat this, but it's a good idea to know what it is.
Month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.